sector and its management model. Hello, good morning, everyone. I have been introduced before. I'm Mohamed Parrini. I'm CEO of Hospital Moinhos de Vento in Porto Alegre, south of Brazil. I'm here to be the moderator of this very interesting discussion about healthcare in France and the contribution of the private sector and the management model. We have Thierry Chiche, who is CEO of Elsan, who is a private hospital network in France, a leader in France, with 25,000 employees and 6,500 independent physicians working in 120 different centers. They have over 2 million patients every year. It's really a pleasure to welcome you here. I also have here Carlos Murillo, who is CEO of Pfizer. No introductions required. Pfizer, one of our main hopes nowadays for the vaccine. We have José Henrique Salvador, who is CEO of Hospital Network Mater Dei. Welcome, everyone. I'm very pleased to be part of the Forum of Health Innovation 2020. Questions may be submitted through the chat, and you can see that on the screen. They are going to be sent to one of our discussants or the speaker. I'm going to start by inviting Thierry, CEO of Elsan, to tell us a little bit about how this important healthcare system works. Our speaker has 30 minutes to make his presentation. Good morning, Thierry, once again. It's an honor to have you here with us.
Hello, everyone. I hope that you can hear me well. So I'm Thierry, I'm the CEO of Elsan. As you said, we are the number 2 French hospital operator. We are the number 5 in Europe. Actually, we are in the middle of the second wave of COVID here in France, and with the team we are traveling around to visit the clinics, so I hope the sound is okay. And I must say that I'm quite sad not to be physically with you in Brazil. I love the country, so I've decided to wear some Kitas de Senor Todofim to remind me about the good feeling about your nice country, so that I can be a bit more with you tonight. And the private part of it. As you may know, France is the second largest healthcare market in Europe. It's a 260 billion euro, so around $300 billion market. And as you said, almost 80% of it is publicly funded, both towards the public operators, but as well towards the private operators. And in this market, in this 260 billion euro market, the hospitals, all the range of hospitals, they represent around 90 billion euro of cost. So it's a significant part of the global budget. I think, as everywhere in the world, this market is growing steadily because this market is based on a demand that is mostly driven by the demography of the people and the aging of the population. So in France right now, we are in a market that is growing steadily, 2.3, 2.4% a year, and that with very consistent visibility. It has been year after year after year. So this is a very positive thing for us to plan for the healthcare system with such a visibility. Maybe to understand it better, the market, because this is very specific to every country. We enjoy in France a full freedom of choice for patients. That means that when you are a patient, you can decide where you visit a public or a private hospital, and it's reimbursed the same way by the Social Security. So there is one market with two sectors, but it's really the freedom of choice for patients. And so quality of care, we have an alignment, because if a doctor is not good, he doesn't get any patient addressed to him, and that's also a problem for the hospital. In terms of level of activity, exactly the same, because if the doctor is not working, he's not going to be paid, and so for the hospital. And also in terms of reputation, and we could talk about the quality of care, but also the reputation. Of course, you have to treat your patient well, not only medically, but also to take care that everything is okay, that you provide the best environment for care. And this is also something which is an alignment of interest between the doctors and the hospital providers. So as I said, the context is very positive for the private sector in the hospital field in France. And to date, the private sector has really become instrumental. I mean, it's really an essential part of the system. It represents more than 30% of the hospital stays, and it represents more than 50, even more than 55% of the surgery in France. So for example, at Elsan, one patient out of 11 in France that gets a surgery, he gets surgery at Elsan. So you see how essential the private sector is, and within the private sector, a company like Elsan. I think there are many benefits to this, and that's the reason why there is a planning around this system with the freedom of choice. You have quality improvement that is continuous and that is driven by these different types of operators. In the private sector, we believe that we are a bit more advanced in terms of modern medicine compared to the public sector. For example, we have reached a level of more than 65% of day surgery in France in the private sector. It's only, if I may say so, 40 plus % in the public sector. So you see more than 25 points more ambulatory care and daycare. We also measure quality, and we have better quality measurement KPIs. And last but not least, so we are all paid and financed by the public NHS, but the tariffs for the private sector are more than 20% lower than the public. So it means that for exactly the same surgery, we get paid 20% less than the same surgery being performed in a public hospital. So you see how efficient the private hospitals are for the system. And again, for a company like Elsan, we save the state, the French state, more than €500 million every year due to our efficiency. So we saved the French state, just Elsan. And globally, the sector is providing around €2 billion savings for the state because of the efficiency. So this is in normal time. This is also true actually in the crisis mode. As I said, we are in the middle of the second wave of COVID in France right now. There's been a second lockdown that has been enacted a bit more than 1 week ago. And during the crisis, the private sector is also extremely present aside the public hospitals, as well for the ICU capacities. And so we have deployed. We have offered all our ICU capacities for the benefit of the crisis management, and we have increased. We have tripled, by the way, the ICU capacities within weeks to be able to take care of all the patients. And right now, up to 20 to 30% of the COVID patients in France are dealt with by the private operators. So we are absolutely instrumental in the crisis management right now, with a very interesting cooperation. We are cooperating locally and nationally with the government and with the hospitals on the field in order to organize ourselves. And sometimes we take the surgery for an area, and the public hospital is dealing with the COVID patient. Sometimes we take the COVID patient in our hospital, and they keep doing the other activities that are needed, of course. So this is a cooperation that is very interesting, and this shows, I think, um, really the role that is absolutely crucial of both sectors. So maybe to give you a bit more of insight of Elsan within that, because we are, as you understand, a key player in this story. So Elsan actually is the fastest growing private hospital platform in France. Today we enjoy a $2.6 billion revenue. It was 500 million 5 years ago. So you see the growth rate of the company. And right now we operate 120 hospitals all over the country. And we have really an unrivaled footprint in the regions, probably the most national footprint among all private operators, because 3 French people out of 5, they live less than 50 kilometers away from one of our hospitals. So we really cover the country. And we have decided to organize ourselves in clusters, actually a bit the same way as the public hospitals do in France. And they have some clusters of hospital regionally, because at the end, healthcare, at least for acute care, we believe is very much a question of local presence. Some people travel 1,000 kilometers to get surgery, but most of the people get the surgery and the treatment not too far away from their home, their family, their base. And that's very important. So this is something we have organized as well in Elsan. And actually we operate, to be a bit more specific, we operate 6 verticals of care, which we believe are complementary, high medical value. Of course, medical, surgery, and obstetric. This is the one. Rehab, dialysis, cancer treatment. We are the number 1 in France in radiotherapy treatments, imaging, and something that may be specific to France, which is home hospitalization. And this is something that is really growing fast here. We are already number 1 in France in this field, pushing the development of the activity. And here is really the hospital into the home of the people, which is actually very interesting, because people, they love it. They want to stay at home as much as they can, and it's much less expensive for the state and for the system. So this is a new way to treat people, and this is really hospitalization. It's not just nursing. It's really high level hospitalization with doctors, with a high level of treatment. So this is Elsan, and I think as you do everywhere. So we are inventing with the doctors medical projects in the field with them in order to provide the best care. And we are also very much focused on efficiency, because as we mentioned, our tariffs are lower than the public one, and probably the same as in Brazil. You know, the healthcare expenditure trend in France is a 4+ percent CAGR increase, while the GNP in France is growing less than 2%, probably less than 1.5%. So this spread between the increase of the expenditure for healthcare and the GNP is unsustainable over time if you don't provide productivity. And so that's what we do as well, because that's part of the story. So maybe I will stop here. I could probably dig into details, but let's do it around the questions that you have.
Muito obrigado, Thierry. Foi bastante esclarecedor, né?
Thank you very much, Thierry. It was very clarifying, and I'm very pleased to be part of this panel, because the main inspiration for our healthcare system was the NHS, the British model, and I had to study a little bit more the French model, and I learned a lot. And I need to learn. And it was very interesting to learn that there have been changes in the past 5 or 10 years in an attempt to respond to growth and aging challenges. I think that you are giving a very good response, and Elsan is part of this gear and to be able to contribute to the development of French health and the population. Thank you very much for all your explanations. You're going to come back soon for questions, but right now I would like to give the floor, and it's an honor to have Carlos Murillo from Pfizer here to give his contribution. It's 10 minutes. And then we will be back with questions to Carlos Murillo. And once again, I would like to thank you for your participation. It's an honor to have you here with us, Carlos. Good morning. Nice to meet you, Mohamed. Thank you very much for the invitation to be here. It's a pleasure to meet Thierry and José Henrique, too. Well, first, I'm going to draw a few general reflections of how we see the healthcare system. And as you accurately mentioned, Mohamed, what you said about the Brazilian healthcare system and some significant differences that we have noted in France and Brazilian healthcare systems in terms of access to care and reimbursement for medications. So innovative molecules that have transformed the way we treat diseases that have a heavy impact on the health of humankind are very important for Pfizer. And in addition to that, we need to have a work for these innovations to get to the hands of patients. In Brazil, with the creation of SUS, is the possibility of providing access to these medications. The quality of access to technology, and especially the innovative ones, and financial and management sustainability depends directly on the assessment of these technologies. The work that is conducted by Conitec, responsible for assessing these technologies or reviewing them, has provided quite a positive impact for Brazilian society. But we understand that it can still improve further. For this reason, over the past 12 months, Pfizer has promoted reflections and conversations with other stakeholders in terms of the review and assessment of health technologies and their incorporation
So what he said was very interesting to advance in this process. So it's a rapid reference to all of you. So the rate of incorporation of medication and vaccines is 70% when a demand comes from SUS. It's internal demand, so it's quite high. However, when demand comes from the industry or from other sectors in societies, that so-called external demand, the incorporation rate is only 41%. Another theme that we have identified that needs or that can be improved for the country is access after incorporation. So in theory, we talk about 180 days, but in real life, we know that in practice, the average is almost 360 days. So based on these numbers and the information we get from professional associations and patient associations, we have come to a few things that can be related to the recommendations of Conitec. And now I'm going to try and draw a bridge with the French healthcare system and what are the things that in our understanding are very positive in a French healthcare system in relation specifically to access to medication. Something that is very positive that you have in French is a very robust assessment of efficacy, followed by a very well-defined structure of pricing negotiation and access based on volume, and a very transparent and well-defined process. The other thing is an opportunity for Brazil to learn that Brazil can learn from France is the early access program that you have in France. So we understand that France is almost a world leader with these regard. It makes it possible for companies such as ours to generate data and revenue and to request refund for products for unmet needs and to generate real-life data, which are very widely used and are very important to assure reimbursement. And the other very important thing that Brazil needs is a clear structure for innovative contracting models. We all understand that we need to innovate, we need to do things differently in terms of access to healthcare and how we, the pharma companies, have access to incorporation and sales systems and to create innovative systems. Right now, the Brazilian law is very restrictive in terms of what can be done. So in France, with that regard, is much more advanced, and we think that this could be a good regimen for Brazil. I'm going to stop here, and then we may continue talking a little bit more further ahead. Thank you very much, Carlos Murillo. I have already some questions to ask you, and I'll ask you afterwards. Now I would like to give the floor to José Henrique Salvador, my friend, my peer, and my partner at CONAP, the current VP at CONAP, and Director of Operations of Mater Dei chain of hospitals, a hospital chain that we are very proud to have as friend, and he's an inspiration to all of us. So inspired on what you heard from Thierry and Carlos, what do you think are the opportunities for our private healthcare system? Good morning, everyone. First of all, I would like to thank José Villar and Rodrigo Villar, too, for the invitation for Rede Mater Dei to be part of such an enriching debate. It's a great pleasure, and I'm very proud to be here with you, Mohamed, Carlos, and Thierry. I had the chance of meeting him in San Francisco, and we talked there, and he could explain to us a little bit more about the French healthcare system, and especially about ELSAN, which is a reference for all of us, what they have been doing in France. Mater Dei Health Network. We have 4 hospitals, all in the states of Minas Gerais. We have 1,100 hospital beds. And we work especially in the private sector. We are building the first hospital outside our state. It's a large hospital that we are building in Salvador, in Bahia. So we are going to go to a different region in Brazil. But we have been trying to change significantly over the past few years this vision of us being a network or a chain that receives sick patients, and in a healthcare system where we can effectively affect and influence the health of people. I think that this has been our mission as a chain of hospitals, and we've been trying to transform our business models during this period. We have a major investment in quality and efficiency. And during the pandemic, we have been able to certify all our hospitals by the Joint Commission International. We are very proud of doing that, and this reinforces our commitment to quality and safety. But in listening to Thierry and what he said and our reflections, and especially now during the pandemic, I think it is very clear to us how important it is for us to reinforce the bonds between the private and public healthcare systems in our country. I think that the collaboration between these two sectors had never before been so important for our industry. If it weren't for SUS, I'm sure that our country now, during the pandemic, and the Brazilians would be much more worsely affected than they really were, because SUS provides major capillarity in the care provided to our citizens in the many regions in the country. With many remote regions, it's been organized to be close to citizens in all cities. But then on the other hand, we also need to think about some differences in performance between private and public entities during the pandemic. If we check the performance of each one of these entities and how they treated the patients during the crisis, we'll start seeing that patients treated in a private system had a better recovery than those treated in our public system, unfortunately. So I think that once the pandemic is over, and then following the teachings of the French system, the private healthcare system, I think we can provide to our healthcare system some efficiency concepts focused on management efficiency, with people training, capacity building, and some lessons that we learned a long time. That treating better our employees, preparing them in the organizations. I think that the private entities are also teaching us some things in terms of flow. All the hospitals and all centers in private healthcare have been able to define very good attention flows to treat not just COVID patients, but also patients with such a severe patients. This is another important reflex of the pandemic. The number of patients with other types of needs failed to be treated in our country, either because they were afraid to go to the hospital or because there were not appropriate flows for them to have access to the system, and also a significant bridge in terms of technology and innovation. I think that private organizations, through investment, have been able to bring more technology to effectively treat patients, but also technologies in terms of data and innovation and information in order to better treat the patients and structure better treatments, and providing more appropriate treatments, more evidence-based. And the private healthcare system can contribute with this type of knowledge to the public healthcare system to help them treat more and better a large number of people. There are some lessons that we have learned from our public healthcare system, from the SUS, which are historical lessons that we need to incorporate in a private healthcare system. I think that the main reference that really stands out is the way we have structured a long time the preventive healthcare system for our patients. This needs to be strongly incorporated more and more in primary care into the private healthcare system, because it is primary healthcare that makes it possible for us to provide better care to people, to keep them healthier, so that they need less treatments that are more expensive, and we can effectively, with this other initiative, reduce the growing healthcare costs. So my initial reflections were this is my input, and we really want to effectively increase this collaboration more and more, bringing the lessons from the public and private healthcare systems in order to improve the overall healthcare in Brazil. Thank you very much for your participation and contribution. I think that in Brazil, indeed, we are very hospital-centric. Even in the SUS, we are very hospital-centric. So family health is a symbol of reference. There are other chains or other links in the health chain that needs to be improved. And we need to improve even more the public healthcare system. I also agree that public and private systems have reduced the level of discrimination they have against each other. So we see many very good things in the SUS, even in times of results management and performance-based payment, some things that we don't see in the private healthcare system, and advanced or anticipated expenses that prevent a lot of cost. So the money in SUS that is spent because there is a lack of early care to patients. And Carlos from Pfizer knows what I'm talking about. I have a question to Thierry, and I'll try to speed this up because we have more 19 minutes. I would like to ask you about COVID, Thierry. What was the impact of COVID in your organization? Because in my hospital, Moinhos de Vento, we are not for profit, but we are private. So we give back to society about 100 million BRL in social projects through the Ministry of Health. But our entrepreneurship, although it's semi-private because we are not for profit, so our entrepreneurship in terms of survival based on our ideas is very similar to your company. So COVID has deeply affected us in terms of business-wise, in terms of revenue. We had a change in the mix of patients we provide care to. What about you? Did it change your revenue, or is your payment performance-based? It doesn't matter what you treat. And what about France? Are you worried you have a second wave there? How is society as a whole responding to that challenge?
Question. Actually, maybe to give you the story of what happened here in France. So we started to be hit by COVID at the beginning of the year in Feb. So honestly, it was very quiet until February 2020. And progressively, the wave was spreading, but we're all learning about that, probably watching what the Italians were doing in Europe with a bit of complacency, which is not good. And so, because they were just in advance to the rest of, compared to the rest of Europe, but we didn't understand that at the time. And, actually, mid-March, because of the wave becoming too heavy, the government decided to confine the country, so to lock down the country, and to stop, and they asked all the operators, all the hospitals, public, private, everyone, to stop all the elective surgeries. So for a company like mine, it means that within 3 days, we had to stop, to deprogram and to stop the equivalent of 60-70% of the activity, which is of course huge. And we kept only the urgent life life-threatening activities, so cancer treatments, dialysis, of course, all the heart surgeries and heart and all the cardiovascular urgent interventions, but digestive interventions. But this were really specific. So you can imagine that, for example, activities like ophthalmology, orthopedics, it was almost brought to zero. Um, Actually, we didn't think about money at the time. We really united. I mean, all the hospitals, we united around the crisis and to create the right response. Because I mean, I can tell you, we worked all days and nights. We were looking for masks, spending the nights to try to find some masks in China, to find the gloves, to find equipment to protect the teams. So it was really to find equipment for the ICU, because we had to triple the number of ICU beds within few days. So this was really a tremendous part of the work. And I must say, during the 3 first weeks, we didn't even think about money. I mean, we just, let's do the job, let's save the population. The very good thing in France, I must say, and this is something I'm really proud of, is that very fast the government understood that I mean, we had to sustain the effort over time, and a private company cannot sustain the effort, pay the wages, and not get and lose 70% of its revenue and be in the crisis mode for long. So they decided by the end of March, they decided to give us some advances, so some treasury advances, and as a company, of course, we used all the credit lines that we could activate to manage the cash flow, the cash of the company, the treasury of the company in the first weeks. But the state responded very fast. And by the end of May, which happened because we negotiated with the government, actually we implemented, both for public and private hospital, a revenue guarantee. It is covering the full year 2020, and that is really are not covering all the revenues, and it covers around 80% of our revenues. But this is really something that is really ensuring that we can cover our costs and get concentrated on taking care of the people, both COVID and non-COVID. So this system is still in place, and actually we didn't have to discuss it again. So during this second wave, because this is still in place until the end of the year. One of the questions is, will we need it in 2021 as well? This is a question. What is interesting as well is that between the two waves, we had some huge activity increase because there were a kind of lack of surgeries to be performed that needed to be performed. The patients had to wait months to get treated. So we had an increase of activity, but now we reduced again because we were in the second wave. So this was really but at the beginning, and I must say, all the doctors, because they potentially have lost a lot of money as well, and the private operators, we didn't even think about money. I mean, we made the job, and we are very proud of it.
Muito obrigado, Thierry.
Thank you very much,
Queria destacar
Thierry.
aqui que no
I would
Brasil,
like to highlight that in Brazil we have over 6,000 hospitals, and most of the hospitals, except for the few private hospitals which are part of the new networks of hospitals in Brazil, which are welcome, of course, but most of them have a profit margin of 1-2%. Some of them have losses, right? The Ministry of Health in Brazil has also supported the public hospitals quite a lot. And private hospitals all have been making a loss, right? Because the government did not provide any additional revenues to us. They have provided some level of advances, but nothing to support our activities. I'm here on behalf of a not-for-profit organization, and I have to tell you that this is how it happened. And in Brazil, we did exactly what you said. First, we dealt with the crisis, and then we started thinking how to do with the financial crisis resulting from it. I have one question to ask Carlos, because I've been hearing about a vaccine. There is a big discussion here in Brazil now, and there is a lot of political conflict in Brazil right now, and the coping with COVID has not been very well dealt by the authorities. Just yesterday, there was a big discussion about the vaccines. Your vaccine is good, the other vaccine is not good, that kind of political use of the crisis. But Pfizer, well, Pfizer, everyone is very looking forward to the vaccine. Professionals are in burnout. We are looking forward. We need a vaccine. Can we have hopes? Tell us about Pfizer. What is the current status of development? When are we going to have the vaccine from a logistic perspective? Just overcoming, of course, any political hurdles you may come across. Well, Mohamed, I would like to start by saying that we have very promising news, really. We are very close. We are on the verge of having good news. The development of vaccine has been developing quite successfully, and we are obtaining the results of great collaboration of different processes and different joint efforts. This week, we have announced some preliminary results, not final results yet, but showing that Pfizer's vaccine has efficacy over 90%, which was much higher than what we had initially expected. FDA expected a vaccine to be approved with at least 50% efficacy, but now we have 90% efficacy, so it's very promising. This is big news, and the whole world needs news like that. We need a light in the end of the tunnel, which is going to help us get free from this situation. So I'm very expectant, and I think we are going to obtain that eventually. And if that's the case, we estimate to have it approved first, a fast-track approval by FDA in the end of this month. So a country such as U.S., then some European countries and Latin American countries that have really started purchasing the vaccine. So it means that we will have the vaccine available to the population. It's still some initial levels, end of this year, beginning of next year. Of course, we are going to have a limited production at first. It's something that the company is now dealing at a risk level, but the amount will be increased as we move on. At first, we're going to have a limited amount, but at least we are going to start vaccinating risk groups, such as physicians, healthcare professionals. So it means a lot to all of us, right? And I'm really optimistic. I think this is going to be the case. And I'm also very optimistic because I think we are going to have more than one vaccine, and it's fine. This is a given, really. Maybe the times will be somewhat different, and some will be ahead of the others. But yes, we are going to have more than one. We need more than one so that we can have more doses to vaccinate the whole population as quickly as possible. So we need, of course, safety of the vaccine. And I don't think political issues have a role to play right now. I think we need to have safe good products to give to the population, and we really have to respect all the agencies that are going to assess our products. I know FDA and Anvisa, they have procedures to follow and regulations, and it's really high-level criteria. So it's Pfizer with whom? The association. We started work with BioNTech. BioNTech is a biotechnology company in Germany. For some years, they started developing the new technology of mRNA vaccines. And the purpose was to come up with a more effective synthetic vaccine for influenza, for example. And it's a huge advance of science, a breakthrough. We are talking about a synthetic vaccine that is going to give engineering information so that our body manufactures a protein against the virus, something that would never have been thought in the past, and really, really safe. And as this is a first vaccine, we need data. We need hard and really reliable data. José Henrique, let me ask you something. What do you think about the future of Brazilian hospitals? We still have a hospital-centered system. Some hospitals are better than the others, better positioned, have their own strategies put in place, such as your case and also my case. What about the future? What are going to be the challenges of Brazilian hospital to understand population aging and also the economic challenges that society at large has been facing? What funds our organization is always the same thing, the wealth of a country, GDP, jobs, families, households that fund the government. Families pay taxes to the government, and families and households also have to pay for their own private insurance. So if the economy does not succeed, what do you expect to be the challenges that we are all going to face? How can we react to meet these needs?
Well, Mohamed, I think this is a very good question. And it goes through the challenge of efficiency. I think that this might be the main front that we need to think about as hospitals. So when we talk about efficiency, there are a few factors that have an impact on efficiency. First of all, obviously, there is an issue related to size. Thierry, can you please close your audio? Mute it. Mute your mic, please. Can you mute your mic, please? And then we have, thank you. And we have a large efficiency. And because of that, we have a survival in the mid and long term. So I can see organizations getting together in networks and partnerships, alliances that can be made in our industry. So when we talk about efficiency, we're also talking about quality and standardization. So standardization and quality through the acquisition of inputs, and also standardization through care-related or care provision practices that we need to adopt to effectively build platforms that can be reproducible and efficient. This is what we have been trying to build. I think that another factor that is very important is also for hospital organizations to start thinking less again on just meeting the needs of patients or sick people, but also having an effective participation in keeping people healthier. So this also prevents these organizations to take on more risks, to look after populations, to kind of go beyond their walls and to be closer to people, once again, through innovation, through new models that we need to create. When we talk about funding in our private healthcare system, sometimes we're too much focused on our relationship with the payers and health operators and insurance plans and health plans. Right now, the moment we've been going through in the pandemic also provides the opportunity of us creating a novel funding models. So it can be the model we have seen initiatives of the field hospitals as a response to what we were living in our country. And we in Rede Mater Dei provided 180 beds to a field hospital that we built here and bringing together 3 points. So hospitals and healthcare services, the government as one of the funders for the people who would work in a field hospital, and also entities from society, such as businessmen who contributed with supplies to make it work. So I think that this type of organization doesn't necessarily be only used at the pandemic, but we can resort to it more and more so that we are able, through existing financing, to have a model that is more efficient so that we can also provide better quality health. And as a reminder, it's not just these entities. In our country, we have a knowledge, technical knowledge, and of the industry that needs to be used and that provide efficiency. As a reminder, a project we took part in to develop a local respirator that costs 10 times less than the respirators or the ventilators that we import to Brazil. So I think that we have good opportunities to work on efficiency to have a healthier healthcare system. Thank you, Zé. Well, actually, we are about to end. We have another 10 minutes before we close. I'm going to ask a final question to Thierry, our keynote speaker. So when I tried to find more information about the French healthcare system and I read some papers, many papers had a lot of a dichotomy between public and private as two separate things. And I see this is very present and prevalent in Brazil, which is on the right with a lot of discrimination from the private to the public, and the private healthcare system also discriminating the public, one discriminating the other. So Thierry, what do you imagine and what did you have to deal with in terms of discrimination? Is there a lot of discrimination? Do people look down on profit or humane activities in terms of the operation? As a reminder, what we do here, which is in the core of what we do, are human beings, patients, in terms of cure and prevention, but the healthcare workers too. So how we look after our healthcare workers and burnout. So how did you deal with that? And is there such a difference or discrimination in France?
Actually, as you understand, there is one system and two sectors, and we are with this full freedom of choice, so that really patient can go from one side to the other. So we have this, we take care of the same patients, by the way, and for sure there is an ideology that is still very present in some people's minds, that healthcare should be public in France. And so, France sometimes is a very communist country. I'm sorry to say that, but healthcare should be public, which is stupid. NHS should be public, but after it's important to have the best operators, the best care, and to the best providers, the most efficient for the system. This ideology is still present in some minds, but less and less because of all what we demonstrate every day in the private sector, because of the cooperation also during the COVID crisis, and it has been extremely positive for the private sector. And what we want and what we do to fight this ideology is to stop talking and start acting. Because when you act, when you have the same goal, when you have an objective, you're not anymore in the ideology sphere. You are just dealing with patients, making quality care, and that's really what's important at the end. So that's the way we try to move this ideology away from the system.
Adorei, é uma honra para mim. Novamente,
I
agradecer
really
ao
loved
José
it. It's an
pelo
honor to be
convite.
here. I would
Eu
like to
aprendi
thank for the invitation, and I learned a lot today. I would like to thank Thierry for what he told us. We learned a lot from you, Thierry. I would like to thank Carlos Murillo, not just for what you said and for the hope you are giving us. Congratulations to Pfizer for their leadership. And José Henrique Salvador, thank you very much for what you have taught us in terms of connecting public and private and Belo Horizonte model that has been an inspiration for Brazil. Thank you all very much. I would like to thank our audience, and once again, we are here in FIS watching the other conferences. Thank you all very much.